The National African American Child and Family Research Center, but we can just say the center. We are established to really provide research specifically around early childhood education, economic mobility, as well as child care assistance, and really making sure that those programs that work in those areas are better serving African American children and families.
The National African American Child and Family Research Center is the first center to be funded by the federal government to do this kind of research.
Yes, we are the first, and this is a huge deal.
Our goal is really to have this national community engaged research framework so that those who are developing programs, those who are developing these policies in these spaces, they're able to understand what's really going to work and better serve these children and families. We are so honored to have the center based at Morehouse School of Medicine, which is a historically Black medical school in Atlanta, Georgia. It's such an honor to have it hosted there because our research is really community-based and community-engaged research, and that is something that is a hallmark of Morehouse School of Medicine.
We focus heavily on partnering with community residents and community-based organizations to develop protocols and interview material to lift up the voices of those that are the most directly impacted by the issues that the center studies, and that is the issue of poverty.
When you join in with the community to figure out what are your greatest hopes, what are your greatest desires when it comes to your children, that's a point that we can join in collectively and get not just buy-in, but get trust.
We wanted to first build relationships by doing an environmental scan first to understand, sort of through resource mapping, who's actually on the ground working with residents in the area selected for the work.
We really embed ourselves in community to listen and hear from participants in the programs that we're interested in concerning Head Starts, temporary assistance for needy families, and other programs administered by the Administration for Children and Families.
With the resources that are being provided for people, it's not that it's not enough, it's not what's being given to meet their needs. And so that is the ongoing struggle where the families aren't getting the support.
There's a certain level of touch that you get by being in person and literally visiting those communities and seeing the people for yourself and seeing the communities for yourself. Not only are we gathering their lived experience, but we're having an experience of our own.
Interviews, conversations with residents, that's just one slice of the pie. Another big part of it is actually digging into some hard to grapple with administrative data sets.
We want to ensure that we are having a basic understanding of the entire landscape when it comes to African American families. And so we really want to access national data sets that are representatives.
And using that information to pair with the qualitative data to tell a whole story of how Black children and families are experiencing programs that are administered by ACF.
In a rural area, like I'm from Mississippi, and it's almost 80% rural, right? Services were provided, but their proximity to those services was questionable. No public transportation was available to them in those rural spaces, so it was still problematic how they would sign up or get to those appointments. Quality childcare, quality health care is important for us to go out and get this narrative, because otherwise the story is they just don't make their appointments. They really don't care. Their access looks a great deal different. And so I think we have to understand that.
We want a voice for our community. We want a voice for our children. We want a voice for policy. We want a voice for change. And this research, it's near and dear to us because it not only promotes the health and well-being of families, but it promotes research so that funding agencies and organizations can see that there are support and resources out there
As a center, we have focused on building the research capacity of not only community-based organizations, but also students and other researchers. We have an emerging scholars program for undergraduate and graduate students who are interested in research in those areas, and particularly with African-American children and families. We have that pilot project program for community-based organizations, leveraging those resources that are already in the community, giving them support to do research on things that they know works, and that things they have been doing in the community.
We're hoping for systems change. That is the ultimate goal, recognizing that the programs and the services oftentimes don't meet the needs of the families. We're actually providing a roadmap or a blueprint through our research agenda to help these stakeholders implement those solutions in a way that has the most impact, drives equity, and ultimately improves economic mobility outcomes.